The nursing workforce in the last 10 years has been through hell and back. We got through COVID. I've got colleagues who've died from COVID. I myself have had it 3 times. Morale is rock bottom. Today is the first day that we've actually got pride in nursing. We've walked out of the hospital. We've still got protected areas such as chemotherapy, dialysis, intensive care. But today we finally realised that we've got the power to take back control, to get our fair pay and to get safer staffing. Morale is rock bottom. Nurses are leaving. There is a huge exodus of senior nurses. So my personal experience, after COVID, after redeploying to intensive care, where I saw more death in 1 year than in 14 years as a nurse, I realised I had enough. So I resigned. I had no job, I had a mortgage to pay, and I basically went to see my family and I went to see my friends. I then realised, actually, I still have the power, the energy and the passion for nursing, and I decided to come back to the cancer chemotherapy department. When I came back, it was even worse than before. And then I realised, how long can I continue this job? This job is slowly killing nurses, and that is why nurses are leaving. The pay is not reflecting the safety critical job that we do, but again, the mental, emotional and physical torture of 12.5 hours in a hospital shift, it can't continue like this. That is why we're striking today. It's not all about pay, it's also about the quality and the safety of patient care that we deliver. Things have been tough. I've been living in a flat share, unable to afford basic or decent quality of life. So imagine working 4 12.5-hour shifts in a row and then going back to a communal flat share with no living room and basically having to watch how much money I spend on the food, on my rent, not being able to have the lifestyle that I wish to have or the aspirations that I want to achieve. Well, I spent the last 10 years just desperately trying to save up, just to get a deposit, just to try and get a 1-bedroom flat out in Zone 5. This is not the lifestyle that I expected to have. Now, I entered nursing to look after patients. I'm proud to be a nurse, I'm proud to be a chemotherapy nurse, but what I'm not proud about is day in, day out, every single shift being short-staffed, patients not having their pain relief for hours on end because there's not enough nurses, or patients effectively sitting in their own bodily fluids because we're physically unable to provide them quality, safe care.
This is an opportunity for our voices to be heard. Nurses have been really barely coping over the last 10 years, especially over the last 3 since COVID. We're not being listened to and nurses are leaving in droves. We are not going away. This issue is not going away. We need nurses. Nurses are the lifeblood of the NHS and the healthcare system in general. And if you do not pay us properly, it's just, there's a disaster waiting.